Delegation in nursing is one of the most frequently tested competencies on the NCLEX, and at the same time, one of the areas that generates the most uncertainty. Understanding how to apply delegation in real life scenarios is what makes the difference between passing with confidence or hesitating at every question. In this session, we will break down what safe delegation truly means, the legal and practical boundaries you need to know, and how to identify the safety sensor on the exam. Delegation is much more than simply assigning tasks to others. It is a process by which a registered nurse, RN, transfers a specific task to another member of the healthcare team, while always maintaining ultimate accountability for the outcome. The nurse must approach this role with sound judgment, leadership, and effective communication. Join me, and I will guide you with clear examples and strategies that will help you to master this topic both for the NCLEX and for your professional nursing practice. A key NCLEX tip is when you read the word delegate. Think about legal limits, professional roles, and patient safety. That's why it is important to remember. The act of delegation is regulated by the state boards of nursing in the USA. The RN does not transfer professional responsibility, only the task. And finally, the primary goal is to ensure patient safety while optimizing resources and time. The NCLEX emphasizes the so-called 5 rights of delegation. Let's break them down. First, right tasks. Only activities that do not require nursing judgment can be delegated. For example, checking capillary blood glucose in a stable patient. Second, right circumstance. The clinical situation must allow delegation. Taking vital signs from a critical postoperative patient is not the same as from a stable one. Third, right person. The task must be assigned to someone with verified training and competency. Fourth, right direction communication. Instructions must be clear, specific, and followed by confirmation of understanding. And fifth, right supervision evaluation. The RN must monitor, provide feedback, and ensure that care was completed correctly. These principles are foundation for answering NCLEX questions correctly and for ethical professional practice. Let's talk about what can be delegated. When delegating to AP, assistive personnel, think of routine, repetitive, and predictable activities. Examples: patient hygiene, bathing, bed changes, oral care, recording stable vital signs, assisted feeding, measuring intake and output, transporting stable patients, collecting simple specimens such as urine. In contrast, when delegating to LPNs, licensed practical nurses, the tasks are more technical but without critical decision making. For example, administration of oral and topical medications depending on state regulations, reinforcement of the education previously provided by the RN, simple wound care, monitoring stable patients. Finally, anything involving critical judgment, assessment, teaching, or care of unstable patients remains the sole responsibility of the RN. These tasks cannot be delegated. Initial patient assessment, nursing care planning, critical decision making or changes in the plan of care, initial patient and family education, managing an unstable patient or those with acute changes, and finally, administration of IV medications in clinical situations, depending on the state regulations. When answering NCLEX delegation questions, first, identify stability. Ask yourself if the patient is stable or unstable. If unstable, the task cannot be delegated. Second, evaluate knowledge required. If the task requires clinical judgment, it belongs to the RN. Third, apply the 5 rights. Use this filter to decide who should take the test. Fourth, use elimination. Rule out what is clearly the RN's exclusive role. And finally, fifth, prioritize safety. The safest option is always the correct one. Classic NCLEX example. A postoperative patient requires the first ambulation. Who should assist? The answer is the RN, because it requires critical initial observation. Let's look at two quick examples. First case, a patient with controlled hypertension who needs vital signs checked every 4 hours, delegable to AP. Second case, a newly admitted patient with chest pain and dyspnea. Only the RN can access this patient. This shows you how NCLEX questions always revolve around safety and clinical judgment. Delegation in nursing is not just a technique, it's an art of leadership, management, and safety. For the NCLEX, remember, a stable and routine tasks can be delegated. Anything requiring clinical judgment, teaching, or involving unstable patients remains with the RN. Always use the 5 rights of delegation as your guide. And if you want to continue strengthening your NCLEX preparation with practical classes, real examples, and proven strategies, join Enfermeras Venusa. Here, we transform knowledge into confidence so you can pass on your first attempt and achieve your goal of becoming a registered nurse. Because your success on the NCLEX is the beginning of your professional future.